Hello, and welcome to part 2 of our data training series, Measuring What Matters Using Data to Evaluate, Develop, and Improve Programs. So just to recap, this is the second part of a 3-part training series on how to work with data. Our target audience would be any agency or program administrator who wants to learn more about how to collect and utilize data more efficiently for evaluating your program. So in the first part of this training series, we focused on the first 3 objectives. And for this second part, we're going to focus on objectives 4, 5, and 6. So we're going to answer the questions: how do you access and organize data? How do you make sense of what your data is telling you? And how do you present your data for external audiences? The facilitators for this training are me, Dr. Nicole Mattocks, and Dr. Jay Unick from the University of Maryland School of Social Work and the IRIS Project. And we'll also be featuring our community partner, the Behavioral Health Leadership Institute. To review, in the last part of our training, we developed a roadmap for the following. We looked at what it is your program is doing, what you expect to see change as a result of your program. We talked about how to concretely measure that change, assess whether or not you have the data to measure that change, and if not, start looking for or designing measures to capture that change, and then collect that data. We used an example from a behavioral health urgent care clinic, the Arundel Lodge Behavioral Health Urgent Care Clinic, to look at a particular program and map from the activities and inputs involved in making the program run to the outputs, and then mapping out what we expect to be the short-term, medium, and long-term outcomes. And it's important that we are able to draw this map. This is a logic model. It's important to be able to draw a map from the program activities to what we expect the outcomes to be, because those outcomes are ultimately what we're going to be measuring to determine whether or not what we're doing is effective. So using the example of the behavioral health urgent care, we came up with a number of outcomes that we expect to see. So things that we expect to change and improve ultimately from the results of clients or individuals using the behavioral health urgent care. We expect to see a reduction in psychiatric hospitalizations, a reduction in emergency department visits, and we expect to see increased long-term stability for individuals experiencing behavioral health challenges. And so what we want to do whenever we're thinking about the outcomes we expect to see is we need to think about what kind of data we would collect to measure whether or not we're achieving these outcomes. So we would look at maybe rates of psychiatric hospitalizations among urgent care clients. Have those numbers gone up or down? Have they changed over time? We might look at number of clients served at the urgent care clinic, rates of emergency department visits, and then reasons for those visits. And we might also want to look at clients' mental health symptoms over time, their substance use over time, housing stability, overall functioning, and other service use. Are they using other services as needed as a result of coming into the urgent care clinic and being referred out for other services? So we've developed a logic model for a program. We've mapped the outcomes, thought through ways that we might measure those outcomes, whether or not we've achieved them, through different types of data that we would collect. And we would think about what data we actually already have. So most agencies are already collecting a lot of rich data on clients and systems. So what data are you already collecting? Are you measuring clinical and treatment outcomes? Are you measuring outcomes based on maybe diagnoses, symptoms experienced? Are you measuring demographics? Are you collecting information on demographics from your clients? Are you assessing patient satisfaction through questionnaires or interviews? And are you also measuring attendance or completion of programs? These are types of data that you might already be collecting through your program delivery and service models. But some of that data is measuring outputs, and what we want to ultimately measure are outcomes. We want to measure if the programs are influencing short, medium, and ultimately long-term changes that we'd want to see. So some of the types of outputs would be measuring attendance or participation in programs, completing a program, and satisfaction. And these are all really valuable pieces of information. But in order to see if the programs are having a longer term impact and maybe a deeper impact on clients, we would want to measure things like attitude and behavior change. In a lot of cases, changes in symptoms, hopefully reductions in symptoms, and reductions in certain consequences like hospitalizations, criminal justice involvement, or experience of violence. So that's where we left off. And today we want to talk about how to access data that you don't have. So you've thought about what data you need and what data you have. So you may need to start accessing data from other sources. You may need to collect some of your own data in addition to what's already being collected through your service provision. And then you need to start thinking about how to organize that data so that you can use it to answer important questions about effectiveness. So these next steps that we want to talk through right now are how to collect or access supplementary data that you need to fill in that data gap. So collecting your own data from clients or some of your clinicians, or accessing data from external sources. And then we also want to talk about how to organize that data using something like Microsoft Excel, a statistical software program if you have access to one of those, or we're going to use an example called JASP that Jay is going to talk a little more about and show you using real data, how to organize data that you might have collected already.
So my name is Courtney Nordick, and I am a PhD candidate at the Johns Hopkins Bloomberg School of Public Health, and I'm a research associate at the Behavioral Health Leadership Institute. BHLI is a nonprofit organization that's based in Baltimore City, and our mission is to identify gaps in service delivery for behavioral health and substance use services for vulnerable populations in Baltimore. One of our projects currently is the Project Connections at Reentry, or PCARE, which is a treatment van that sits outside of the Baltimore City Detention Center and provides low-threshold buprenorphine treatment to vulnerable populations. So we use our data in a number of different ways. So everything that we collect for the clinical visits with the providers goes into our REDCap system. And with that, we can take that data and do something like a daily summary report, which takes all the information that the providers have been entering about those clinical visits on a day-to-day basis. And what does that look like? How many people did we see today? How many people missed their visits today? And that helps our communication on a day-to-day basis between our clinical and management teams. But we also can take our data and look at trends over time, or how our clinical flow progressed throughout the year through like an annual report that we distribute to our board or to our funders. And we do this by creating reports in REDCap that people can download, export, and distribute as needed. For example, you can download and export it into a statistical program such as JASP or Stata, and create frequency tables or graphs or trends over time to look at how our clinical flow maps out with our data. So one example we've tried to implement is doing patient feedback forms. So actually contacting patients that are served at our van and ask them how things are going or if there's anything that we can improve upon with our service delivery. And so at the start of COVID, when things were very much in flux, there was a lot of confusion and miscommunication with our patients about Zoom calling and telehealth visits and if the van would actually be on site. And so we would use these conversations that we were having with patients to understand the issues that they were identifying and thinking about our process flow so that we could improve that communication. So by talking to patients, we understood that they were confused about kind of the order of operations once they arrived at the van. They were confused about telehealth visits. And so we implemented new signage at the van to kind of make those rules and process more clear to them. We created pamphlets that people could reference with important information about the hotline to call if they were in need of a telehealth visit. So that's just kind of this iterative process we've had with communication with our patients, our providers, and our research team to try to improve our process flow for the organization. So as the research associate of BHLI, I regularly meet with new nurses and providers on a regular basis to introduce them to the REDCap data collection system, which we use for our electronic health record for our patients. And I describe the data that we're currently collecting for our program, the key elements from that data that are important for our performances and performance metrics and things like that. And I also talk to them about if there's any additional information that they would be interested in collecting or that would improve their clinical flow to help better serve our patients. And I also meet with the management team on a regular basis to discuss those same issues. Are there things that we can incorporate into our data system that we're not already collecting? Or can we improve the data that we're collecting to meet performance metrics that we're trying to address or identify new problems for our organization that we want to follow up with?
Data, diagnoses, symptoms, things that are already collected at maybe client intake. And you've thought about the gaps in the data, what types of data that you need to collect in order to answer these questions about outcomes. Whether your clients are achieving the outcomes that you're hoping that your program will achieve. So I want to just make a note here that data collection could be its own training. This is a really vast topic, and there's a lot to cover here. So we're not going to go too far into the details, but we just want to provide some information about common data collection methods, some of the platforms that are available to help you collect data, and just talk through different ways that you might be able to supplement the data that you already have. So surveys and questionnaires can be administered through a lot of different free, easy to use online platforms like Qualtrics, SurveyMonkey, Google Forms, Typeform, REDCap. REDCap is something that is usually available through higher education institutions. And so if you have a partner who works or community, a partner who is working in a higher ed institution and has access to REDCap, this could be useful for you, but it might not be as easily accessible. And so these are great platforms for being able to easily send out, easily develop a questionnaire and send out the questionnaire to your clients. And there's usually some great tools in there to help you with organizing the data, exporting it into another format like Excel or something, and being able to just in a preliminary way analyze some of your data. So some of these platforms are really very useful, user-friendly for people who don't have a lot of statistical knowledge, but want to get a good sense for what their survey data are telling them. So some of that can be built into a couple of these platforms. I want to make a note about validated instruments. Some of you are probably familiar with instruments like the Beck Depression Inventory, the Patient Health Questionnaire, the Child Behavior Checklist. So these are instruments that have been tested using advanced statistical methods to determine that they're valid, that they're measuring what what they're supposed to be measuring, and they have good reliability. And these are instruments that you can use to measure mostly symptoms, symptoms of depression or anxiety, PTSD, things like that. And it is recommended that if you have a construct that you're trying to measure, and there is a validated measure out there, a validated instrument out there to measure that, and it's appropriate with your population, it is recommended to use a validated instrument. It lends a little more credibility to your findings. You can use.
I want to remind everyone that we will be providing them with a list of places that include recovery measures and mental health and other substance use measures from a variety of different sources. So that information will come with the packet associated with this webinar.
Great, thanks, Jay. Some other methods for collecting data from your clients. You could interview your clients, conduct focus groups, and there's direct observation, and then chart reviews and clinical records. We are using chart reviews in a study right now to supplement some of the other data that's being collected through surveys and questionnaires. And the data in these chart reviews and clinical records can be extremely rich. And so even if they're not charts that are at your agency, you can sometimes access clinical records that are collected from other sources based on your clients. And we'll talk a little bit more about external data sources. We've talked about it in the first training, and we'll talk about it again here just a little bit.
You have a wealth of information at your disposal at your agencies, and you want to use that data as best you can. But often you want to know things about the community that you live in, or other service providers in your locality, or what a typical answer looks like that's for somebody not at your agency. And for these kinds of data problems, you can access external data sources. There's a lot of data available from state, federal, and local governments, and a variety of different agencies compile data. So you want to get familiar with data that's available that answers the kinds of questions you're interested in, obviously. But some common data sources, including come from the CDC. So for example, the CDC collects overdose rates, prescription drug rates, and death rates across the country, even for counties. So you can go to the CDC website and look up how many people overdosed from opiates in your county. The census includes tons of data, just volumes and volumes of data on what typical demographics look like, or what a typical salary or income for somebody is. States collect lots of data. So Maryland, the state of Maryland collects data. We've included a link here for their open data. The city of Baltimore collects tons of data. So for example, if you want to know the number of 911 calls, or where liquor stores are available, or something like that, all of that's available through your local government. So population data is widely available, and it's something that can provide context to what's going on at your agency. So if you're seeing clients that look like this, and the population looks like this, that tells you something. Maybe you're serving a more at-risk population, or maybe you need to reach out and do some outreach for the Hispanic community, or whatever it is that your specific question is. The population data can provide context. There's also just wealth of health data out there. So there's large data on national hospital or medical service data. So if you wanted to know what kinds of people are typically coming to the emergency room. So say you're working on a program that's delivering peer support in an emergency setting, an emergency room setting, are your clients looking like the typical clients that come to hospitals in the state of Maryland or in Baltimore? This is the kind of stuff you can see from this data at AHRQ. Or there's local data in Maryland. So the HSCRC, the commission that governs hospital services in Maryland, has a lot of data on hospital services. So you can get more specific data. Local data from your county or your public health department, or data from a hospital or clinic, can provide even more specific information that is contextualized to the specific geographic area or the specific hospital that you're working with. One really important thing that we can all do is partner with other agencies and share data across systems. I know that there's a lot of initiatives going on here in Maryland. We're working with some partner agencies here that are sharing data across agencies. And that would allow you to know, is your agency looking very similar to what other agencies are doing? If you have partner agencies maybe in a different county or that have a different catchment area, you can find those agencies and partner with them and share data across your systems. Again, you don't have to share information on particular people. You can de-identify the data or remove specific things like names or other forms of data that would identify persons, and then you can share data across agencies and get a sense of, are we serving similar clients? Or are we serving different clients? And that kind of information can provide a lot of important context to the work that you do.
Thanks, Jay. So now we've talked about different ways that you can collect your own data, places that you can go to access additional data that you might need. And now it's time to start thinking about how to work with your data, how to make sense of your data. So there's lots of different types of data. You might have text data. So text data would be usually words or phrases that you collect through open-ended questions, maybe on a survey or on a patient satisfaction questionnaire. You have a question that says, please tell us why you came in today. And so the response might be, my child was having a panic attack and I didn't know where to go. And that is text data. So text data is more qualitative in nature. If you're familiar with the terms quantitative and qualitative, that would be qualitative data. A lot of the data that you're going to collect is going to be numeric or quantitative. So questions like, how old are you? How many times have you experienced this issue? Number of sessions attended. Also scores that are going to be given or assessed on a validated instrument. Other types of data that you might collect would be categories, which can be given a numeric value. So for example, a question would be, maybe, how would you rate your satisfaction with the service you received today? And responses could range from excellent to poor. And you might give each of those responses a numeric value. So excellent is 5, good is 4, average 3, fair 2, and poor 1. And that, when you assign these values, when you assign these categories numeric values, you're able to use quantitative statistical analysis to kind of explore the data that you've collected in a variety of ways. It adds some flexibility to the data that you have. Another example would be like, what is your highest level of education completed? That's a very common question included in an intake session. And this, the responses could be from, did not complete high school to have a graduate degree. And again, these categories can be assigned numeric values, which you can then use later to do some kind of very basic statistical analysis, which could include looking at averages, ranges, things like that. And we're going to talk a little bit more about that with some examples. And the last type of data would be just another type of data to note is names, collecting names of the client, names of other people, and names are obviously protected information. And so you will need to think through how you want to collect and how you want to protect confidential information. So some tips for organizing your data, and I'm just talking through some of this, and then Jay is going to walk you through some examples using a platform called JASP. But just some things to consider. When you're using a survey platform to gather information, I briefly mentioned this before, But survey platforms and EHRs, which most agencies use now, electronic health record systems like Credible, for example, they offer multiple export options so that you can extract data directly from these platforms or systems and pull it into an Excel or CSV file. Sometimes you can export directly into other data format files as well. But I find that Excel or CSV are the easiest to work with, especially because you can then retool those to use in another format. So those are great places to start and kind of play around with your data that you've collected, just using Excel. I recommend developing a code book. A code book is usually a summary of all of the variables that you're collecting. So let's say you're using a survey or questionnaire to gather information about your clients. You would want to have a code book that summarizes all of the questions, the response options, the values you've assigned for those response options. And this is an easy guide that just kind of helps you organize your process of working with your data, especially if you've got staff turnover and you need somebody to take over working with your data or looking at your data. A code book is a really nice guide for helping people kind of orient to your data. As I mentioned before, if you're sharing data with partners, with other people, and with anybody outside of your agency, you will want to assign each of your clients an ID number, and you may already have done that. But you can use an ID number as a way to share information without identifying your clients. I just want to note that if you're using validated instruments, like for example, the Beck Depression Inventory, all of these instruments have scoring instructions, and they'll tell you exactly what the cutoff should be for, mild, moderate, or severe depression. And so you want to pay attention to that. Lastly, with close-ended response options. So when I use the example of categories and assigning them numeric values, try to stay consistent with the numeric values that you choose. It makes your life a lot easier. So for example, if you're always starting at 1 and the increase in the numeric value is associated with the increase in whatever the construct is, that will be much easier for somebody else to make sense of. So if poor is 1 and excellent is 5, and then also no high school education is 1 and grad degree is 5, keeping things kind of moving in the same direction and starting with the same value just makes your life a lot easier when you're playing around with the data. So those are just some tips to help you. And I'm going to hand it over to Jay now to walk through some examples.
Yeah, Nicole, I think one of the things that you said, and I just want to reiterate, is you want to be organized and you want to write everything down. And the moment you're deciding that 1 is equal to female and 2 is equal to male, you will remember 1 is equal to female and 2 is equal to male. But a month from now, you might have forgotten what 1 means and what 2 means, and then you have a bunch of data where you don't know if you're talking about males or females. And developing a code book and being consistent across the options and using standardized scoring, these are all general strategies to help us stay organized and make sure that as we move across persons or across time, that we understand what it is that we did, that we document decisions. This is the old lab book kind of thing. And so making sure that you document all the decisions that you make is really important, because while you might remember it in the moment, you will not remember it in the future. And I've learned that the hard way. So there's a ton of different data discussions. And one of the things we'll talk a little bit about is utilizing statistical consulting services and how to interact with statistical consultants. But I do want to highlight, before we move on to an example of data, 2 basic data structures that you almost certainly use if you are collecting data on persons and services. The types are called long and wide. So we'll start with wide. Wide data is what most of us have in our address book. You have a person, their name, you have their address, you have their phone number, maybe some more information about them. this is just sort of the standard way that we collect data in the simplest format. It's also how we collect demographic data. So things that don't change, like somebody's race or somebody's gender or somebody's date of birth. These are sort of fixed entities. And while they might change, in general, these are sort of static constructs. And so we just need one line per person. And so each row in this data system will have one unit. So if the unit you're measuring is persons, then you're just going to have one row per person. Long data is different. Long data is where we're collecting appointments or service provision. So if somebody comes to your clinic and each time they come into your clinic, John Doe arrived on February 14th, 2020, and then John Doe arrived on March 14th, 2020, you have two lines for John Doe, right? So each line represents a separate event, and that's long data. So for demographic data, we usually collect that in what we call wide data. For service use data, we collect it in long data. And you just want to know what kind of data you're dealing with. In general, anytime you're collecting multiple data on a person, you want to use this long format. The problem is long format data is a little bit more tricky to deal with. We'll walk through a basic example of how you would collapse from long to wide, but I would caution you, if you are dealing with data that involves what we call long or longitudinal data sometimes, you want to get somebody that is familiar with working with this data, because it can become rather complex rather quickly. So now that I've sort of said these words, let me show you an example, I think, to make it a little bit more concrete, because a picture is worth 1,000 of my words, certainly. So here we have an example of long data. So what we have here is data about whether somebody took their medication, whether their medication was dispensed or not dispensed. And so we have the dose date. So this is the date the medication was supposed to be dispensed. We can see that on October 30th, 2019 at 7 a.m., the dose was missed for person number 2. But at later that day, at 2000 hours, I'm not in the military, so I can't quite recall what that is. So what would that be, 6 o'clock?
It's 8 o'clock.
8 o'clock, 8 o'clock. Thank you, math. 8 o'clock, the person did dispense their medication, right? So we have 2 entries for person number 2. We have 6 entries for person number 4. We have 5 entries for person number 5. We have 5 entries for person number 6, and they're stacked upon each other. Some of these are changing, right? So the dose date changes, the dispense date changes, whether they missed or dispensed their medication, all of that changes. But gender doesn't change. They stayed the same gender between 7 in the morning and 8 at night. They stayed the same race between 7 in the morning and 8 at night. So these are the kinds of things that are not changing over time. These are the kinds of things that are changing. And this is why we use this long data, so we can collect all of these events per person. But what if we want to move from a situation where we're presenting all of this data, which gets pretty complicated pretty quickly, to something more conventional, where we could put it in a report and say, the typical number of doses dispensed is X, or the typical number of missed dispenses is X. Well, then we have to collapse this data. And what I mean by collapse is we basically count up the missed doses and count up the dispensed doses for each person. And then if we did that, we would get wide data. So this is a wide data format. And like Nicole said, we're going to use a program called JASP in a second to do a little bit of data analysis, a very simple data analysis. But we're going to use it with wide data. With long data, it's really a different complex problem, and this beyond the scope of this course. And I think that what we're going to do is strongly encourage you to consult with somebody that knows how to use those data structures if you're really interested in looking at that data. But for wide data, what we did here is for person number 2, we counted. They had 2 observations, one they missed, one they dispensed. They're male and they're white. For person number 4, we counted up 2 missed doses and 4 dispensed doses, female, African American, and then so forth and so on. So all we did is collapse across all of the observations we had for number 2, all of the observations we had for number 4, and all of the observations we had for 5 and 6, and we just counted the number of missed and dispensed. Now, one piece of advice, and Nicole had mentioned this earlier, when we talked about thinking through your data and figuring out what you're going to call, how you're going to number things, instead of putting yes or no for missed or dispensed, I used 1 and 0. And I did that for a reason, because now I can just add up all of these, and that's 1. And I can add up these, and that's 1. I can add up these, that's 2. I can add up these for person number 4, and that's 4, right? So if I use 0 for not something that happened and 1 for something that happened, then if I want to know how many times did this event happen, I can just add them up. So a lot of thinking went into deciding to use 1 and 0. And that's consistent with what Nicole was saying earlier about remaining consistent with your applying of numbers to categorical values. So now that we have our data in wide, we can do all sorts of stuff with it. And so what we're going to move on to is, now that we have our data organized, it's in a structure that we want, we're going to make sense of our data. And we're going to make sense of it by first identifying potential problems we have with our data, and then performing some basic statistical functions, just sort of describing what our data looks like. And that's all we're going to be able to get to in this course. There's obviously a lot of stuff you can do with data. There's whole worlds and careers that can be built out of working with data. We want to give you some skills to do some basic stuff. Anything more complicated, we would strongly recommend that you talk to somebody that knows how to use data. Academic partners are very good at this. This is what we do professionally, but there's a variety of different places that you can get some consulting help for working with data. And statistics is hard, and we would recommend that you do that. So the first thing you want to do with any data is look at it. You want to look at your data and you want to know what you have. You want to identify missing data. People don't always answer your questions. People sometimes skip questions. Maybe you have a two-sided form and you find that people are not answering the backside of your form. So the first thing you want to do is make sure that you have identified all of the data problems related to missingness, people that didn't answer questions. That can tell you a lot about your data. They can tell you, did you ask too many questions? Are people, it's not, by the time you get to your 100th question, maybe very few people are answering your 100th question and you need to pare it down. Maybe you're asking sensitive questions and some people don't want to answer those sensitive questions, and that can help you. Or maybe people are confused about your questions. Missing data can tell you a lot of things about your data itself. When you're looking at your data, you want to say, do I have reasonable values? So one thing that sometimes happens is you'll ask for a person's date of birth and they just see date and they write down today's date. Well, they're not 0 years old. If you're working with people that have a substance use disorder, they probably are, 14 and older. So if you find somebody that was just born yesterday, you're probably looking at data that was just missing value or bad value, or somebody put something in that they didn't mean to do. So you want to look at your value, you want to look at your data. And again, we'll walk through a concrete example of how you can do that using a particular open source program. When you're looking at things like dates or percentages or dollars, you want to make sure the format is displayed properly. All of these things can be mixed up as you move from different programs. If you collect your data, for example, in something like SurveyMonkey or Qualtrics or one of these online sources, and you've exported it, you want to make sure that when you import it into a program that it's imported it correctly. And all of these things can be mixed up. Dates are particularly challenging. Dates and times are particularly challenging. So you want to pay attention to whether the data that you move as you move formats is working properly. The dollars still dollars, are dates still dates. And then you want to next address those. You want to clean your data. So you want to make sure that you've identified those problems, and then you want to address those problems. Again, this is where writing things in a code book can help you be very clear, because if you found a particular problem, like Anybody that's less than a year old, we're going to say that that's missing data because they put the current date, not their date of birth. And you just want to know what you're doing so that when you go back in the future, you can have a sense of why you made the decisions you did, or if you're writing it up, that you're accurately reporting the information and the decisions you made. Because you are going to have to make decisions. I have never worked with a data system in which I did not have choices to make. You don't always have all of the information you need to make those choices, and sometimes you have to make guesses. But you want to be consistent, you want to document it, and you want to be clear about what decision you're making. And those things go together, right? So again, when you want to identify problems in your data. When you identify problems in your data, you want to do something about it. You want to make decisions about how you're going to deal with those problems. And then you want to make sure you document them and that you treat them consistently. And that's how you're going to work with all data, right? Like, so that's how data goes. And the key really is document and consistent with the decisions that you make. So now we've got good data. We've got what we call clean data. We're going to do some things with it. The first thing we're going to do is count stuff. How many people do you have? How many people that are male do you have? How many people that are African American or white or Hispanic? How many people are injection drug users? How many people come back after the first service? These are counting. So we count demographics and we count events. And we'll walk through, we're going to call these frequency tables, but we're going to walk through how, given data, we can look at this, look at the data and make sense of it. Well, like I said, we'll walk through an example. A second thing we're going to do is identify what's typical. So often we talk about this as the average or the mean. The mean is sort of the general way we think about this. So it's the best guess with all the data. Each data element, each observation counted as the same. So means are what we use if we want to know, for example, what's the typical age of the people you serve? You add them all up, you divide by the number of people, and you have a mean. So that's what we generally call average. The thing you want to think about with there's another kind of typical value called a median, which represents the middle value. So if you lay out all of your observations, what does the middle look like? And you want to use the mean and the median in different situations. The mean is very subject to outliers. So if you have, so the example that we have here is, let's say we have a town with 10 people and the incomes are 11,000, 15,000, 17,000, 20,000, 22,000, 25,000, 50,000, 55,000, 70,000. And then some dude up here that makes 250,000, right? And you want to describe what is a typical income of this town. Well, if we look at the mean is 53,000, which puts us way up here. So there's only 3 people above that. Is that the typical income? The median is somewhere here between 22 and 25, because all we did is count up 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and just put an arrow in the middle, right? So in here is where the median is. The median is probably a better representation of what the income is in this town, because there's only 4 people that make above 50,000, but 6 people that make below 50,000. So maybe 23, 24 is a better typical value. This is a judgment call, and you want to think through these kinds of decisions. But here's 2 examples of how statistics can get complicated, even with a very simple question of what is a typical value? What single number is going to best represent our data? Okay, so now we have data. We'll have collected the data. It'll be the right kind of data. And the other thing that we want to think about is how we represent that data. And we talked about counting the data, and we talked about identifying what is typical. But now we have to do that stuff. And that's where we use programs. Computers are very good at counting. They're very good at math. So for getting your data and maybe even entering your data, a lot of people use things like Excel or Google Sheets. And we all have to live in our real world. And so that's okay. But for doing things like turning this into information, these are not the best programs. They end up being very complicated. And Nicole and I looked into doing it because we know most people have these kinds of programs. And it was hard for us, and we're professionals. It was hard for us to figure out how to bend the programs to our will. And so that's why we identified a program called JASP. And again, we are agnostic about what program you use. Whatever works for you is what you should use. But we think JASP represents a really easy to use program. And so we want to walk you through an example of how you would take data that you've collected and turn it into information that you could share with funders or with program administrators and have some basic understanding of what's going on in your program. So here's the interface to JASP. I just downloaded this and just installed it on my computer. So this is what you see when you open it up. And it runs on all of the different things. One of the things that sometimes, SPSS or Stata or SAS, there's a ton of these different programs there's a ton of these different programs. They tend to be complicated and built for professionals. This is not built for professionals, although it has a lot of professional capacity. It's really built for people that are new to statistics. And so it's a very flexible, friendly tool. It's open source, so it's free. But it's got a lot of support. So it's pretty well designed. So what we're going to do is we're going to open some data. So I'm just going to navigate to a file that we used that we'll send out with this program. I'm sorry, with the information for the webinar. And I'm going to click on the TEDS 2019 Maryland sample. You'll notice we've stored it as a comma separated value, a CSV file, which is a common exporting tool, but there's lots of different things you can import. JASP does a really good job of importing a lot of things. So I'm just going to click, I selected the file and I'm going to click open here. And now it imports the data. And this is our data. What we have here is data from the TEDS data set, which is again, it's one of those freely available data systems that I just downloaded from the web. It's treatment provider episodes. So it's people that have come to treatment settings for substance use disorders. And so I extracted some data from it. So we've got our education, marital status, gender, age, race, the typical route the individual administered their drugs. So whether it's injection or smoking or snorting or inhalation is what they call it. And then whether they used alcohol or cocaine or marijuana or heroin or methamphetamine or synthetic opiates, whether they're an injection drug user. And then this is a different way of categorizing age. And then, as Nicole said, we have an identification number. So we have no names here. This is why we can share this data widely, because it's totally de-identified. So this is a lot of information. What do you do with this? Well, up here, there's a bunch of buttons. These are some statistical stuff. We're not going to cover that in this class. This is the kind of thing that you would either have somebody on staff or you yourself has some statistical capacity, or you talk to a consultant or an academic partner about how to do some of the statistical stuff. We're just going to work with descriptives here. And that's going to give us some basic information for counting and averages. So all I did is click on descriptives here and I get this interface. So here are my variables over here. Let's say we want to know what's the typical education. So I click on this. All right, wait a minute. That's not very much information, but it does tell me something. It does tell me how many observations I have. I have 871 observations. And it does tell me how many are missing. Ooh, 129 observations I have missing on education. So education has a lot of missing. I might want to think about why that information is missing. I might want to go take a look at that data and see who's missing. But I'm not getting any of this other information because I need to check the frequency tables button. And this is what makes JASP so nice is I just clicked that over, right? And now I click the frequency table. And now I see the information that I want to see. I can see how many people had a college degree or more, how many people that had a high school degree, some college, less than high school, less than 8th grade, less than high school, and then missing. Okay, so this first column is my frequency column. And that tells me how many observations I have that fall within each of the categories. So it just counted the number of people with college. So that's 133 people. That represents 13% of my overall data, but it represents 15% of the data that's not missing. So the percent is overall include, so you can see here that there's 12% of the data that's missing. That's 129 observations. That's what we found up here. But if we want to just ignore the missing, then we can look at the percent valid. And then what we see here is that 15% of the sample has a college degree. 54% have a high school diploma. Less than 1% have some college. 3% have less than an 8th grade, and 26% have less than high school. So we have a pretty good idea of what our sample looks like. And we can do the same thing for marital status. We can see here that 7% was divorced and 73% never married. What we're not getting for either of these is means or standard deviations or minimum and maximum. That only happens because we're dealing with categorical variables. If you think back to the slide that Nicole showed earlier on the types of data, this is what happens with categorical data. We count, we get frequencies. If we wanted to use something like, this is numerical age categories, but if we just pretend that it's age and we click that over, we will get our mean and our standard deviation. If we wanted some more details of the statistics, we could click down here and get the median as well. Or maybe we want some others, like we want better information on the range of the data. So there's a lot of things that you can click here in order to get the kinds of information that you want in terms of tables and averages and standard deviation. Standard deviation is the typical distance from the mean. So how different are people? So if you look at the mean and you look at the standard deviation, you can sort of get a sense of how representative is the mean. And then you also have information on the range. So we know that our age variable, for example, ranges from 1 to 12. So there's a lot of information you can get. And this is very useful information that you can then use to describe who comes to your program, what kinds of individuals are being served, or what, or identify places where you might need to do more outreach. Maybe you want to spend some more time finding married people. I don't know why you would want to do that, but this kind of information can provide details that help you understand what your data is looking like. Now, most of us are interested in more complicated questions of, does this variable, does our output, as Nicole mentioned earlier, produce the outcome that we're interested in? Does the number of visits reduce the number of hospitalizations? That's a slightly more complicated question that we would recommend you consult with somebody that has some statistical knowledge. And then you would use some of these other buttons up here. This program could be used for that as well. So going back to here, and I'm going to hand it back to you, Nicole.
Thanks, Jay. So we just saw some examples of how to start making sense of the data that you've collected. And what Jay was really showing us was how to look at data that is categorical, maybe that's numeric, not really looking at text data as much. And that requires some qualitative analysis. And that is a whole nother training series. So I'm just going to show you some examples of ways that you might want to present findings of categorical or numeric data using graphs and charts. So lots of the different statistics programs, and I believe JASP as well, have there's opportunities for you to produce graphs, charts, and other visual depictions of your data. I highly recommend that you put anything that can be graphed or charted or put into a table, put information in those more visually appealing ways. It's much easier to make sense of data when it's put into something like a graph or a chart. It's a lot harder and takes a lot more time and energy to read through text summaries of this information. So for example, a pie chart would be a great way to represent or depict proportions. So you've got, 100% of your sample, 100% of your clients are giving you information about their race. And using a pie chart, you can see what proportion of your sample identifies as the different racial categories that you provided in, let's say, your questionnaire or in your intake documents. So this is a great opportunity to just provide a very easy to understand visual depiction of proportions. I like bar charts, which is the chart in the top right corner here, top 5 reasons for missed dose. I like these as well. And I think that what you're looking at here is the top 5 reasons out of about 10 reasons that participants or clients identified for missing a dose of their medication. So I like bar charts too, because they can show you the responses. This is the percentage of people who said, I forgot, or I was out of my routine. And you can see the percentages in comparison to other response options. So relative to other responses or other categories. The last graph I have here is this line graph. And line graphs are great for depicting change over time, which is, of course, something that a lot of us are very interested in, especially if we're serving populations over a prolonged period of time, over many service visits or something like that. So what you see here is client A is in pink, client B is in orange, and you're seeing their depression scores from the Beck Depression Inventory changing from intake to 6 months, 12 months, and 18 months after intake. So you're seeing those depression symptoms reducing over time. And line graphs are great for being able to very easily see that change, whether it's a positive or negative trend.
Well, let me jump in here because JASP will also allow you to see those changes. If I can go back to my JASP picture here. One of the things that is really nice about this is that we can do some of those plots that you were just talking about. So we can do pie charts, like you said, or basic distributional plots. Right, so here I just clicked these buttons and JASP produced this. Now, so here you have the pie chart for education, so you can see the same thing we presented above with the numbers around it. One of the nice things about JASP is it's really very simple. They've taken all of the complexity out, and you can see here that these labels are sort of merging together. All you do is you just drag on this corner and it will then rescale it and it looks better. The other thing you can do is export these. So all of this stuff can be exported, and then you can just plop this picture into a report, or if you're reporting to a state agency or you're writing a grant, all of this information can be plopped in directly. And this is the kind of thing why we think that something like JASP or again, any of these statistics programs is going to be better for you than using something like Excel, which is really hard to work with to get these kinds of graphs. Excel wants to do something slightly different, but this is what this kind of program really excels at. So thank you for your attendance on these 2 webinars. We think that the in-person session is going to help us work through some examples. A lot of this is sort of hard in the abstract, and then in the concrete, when you work through your examples, I think it becomes a lot more understandable. What we've tried to do in this series of webinars is help you think through some critical components of answering what matters to you. The first thing is identifying what you want to know and thinking systematically about that. And that's where we use the logic model to think through the inputs and outputs and outcomes that you think you will affect. And then the outcomes, we asked you to think about those in terms of short-term outcomes and then longer-term outcomes. And the reason you want to think through all of these components is because they allow you to identify pieces that you then want to measure. So now you have to think, how do I want to measure my variables? I'm interested in reducing hospitalizations. So you would count hospitalizations. I'm interested in reducing substance use long-term. So you want to know how many people have continued to be in attendance, or how many people reported sobriety, or how many people had negative tox screens. Whatever it is that you want to measure in terms of your outcomes, those should be linked directly to the pieces of your program identified in the logic model. Well, now that you have this data, you have a bunch of numbers or categories. What do you do with it? Well, we talked through some basic ideas. We shared a program called JASP. That's just one way of many different ways that you can use to count how many people you have in each category, or what is a typical response? What is an average response? And that gives you a basic introduction to the idea of using your data to understand what's going on with your program. The most important part here is that all of your pieces are aligned. And that's why we identified a logic model where we break your project into component pieces. We talked about how you can measure each of those pieces and move from a concept to an operationalized variable. We want to measure changes in the rates of hospitalization for our clients. So we are going to operationalize that by counting the number of hospitalization events for our clients. We want to understand, are our clients less depressed? So we're going to use the Beck's depression inventory to apply a number to depression. So we take our variables, our components, we measure them with specific pieces where we now have numbers representing those components or text data. And then we use that data to make meaning. So we count how many people are like this, how many people are like that, or what's a typical response. Data is great, but you have to make sense of it. And we've just given a very small touch of what that means. Again, we hope that if you are working with somebody, that if you have a complicated data system, we hope that you would work with somebody that knows how to do that. And maybe that's the person on this call, or maybe that's somebody else that you bring in as a consultant that helps you work through a lot of these data issues. The key piece is that all of these are aligned, that what you want to know is linked directly to pieces that you are identified in the logic model and is thought through systematically, that you then systematically think through how you want to measure that, and then you systematically organize and clean your data, and then you systematically analyze your data. The piece there that runs through is that it is systematic and well thought through. And that's what is the most important piece about data analysis, is being consistent, clear, and systematic about how you conduct yourself. So what's next? What's next is a live synchronous webinar where we'll walk through examples. We'll use JASP in some concrete ways. It's a 90-minute session. And maybe if you have your own data or some things that you want to bring to the session, we're going to be able to do some of that. So we'll work through some concrete examples and dive in a little deeper to some of the concepts that are probably best done in a hands-on way using real examples. There's no substitute for getting your hands on the data. Something like this is not going to help you through that without some follow-up. And that's why we do the live webinar. You can register for the webinar at www.iris.ssw.umaryland.edu. That information should be sent out to you. And we want to be clear that this is the first in a long series of how you use data webinars. We're going to be talking in future webinars about a variety of different data topics. The world is now filled with data that you guys are collecting at the agency level. What's less widespread is how you make meaning and use data, and that's what we're here to help with. If you have any questions or have some desire for consulting services or want to work with some academic partners, that's what we do at IRIS. That's how we think of ourselves, as people that work with agencies that have data and help them make meaning out of their data. And if it's not us, we can hook you up with somebody that can help you as well. So, even if you don't like us, we can help you find somebody that you will like and that you'll want to work with. So more soon, and we look forward to hearing from you.
Thanks, everyone.